Hello and welcome to another segment of You and Your Health on Health Plus TV with a Health Plus dietitian in Ghana. Last week we discussed diabetes, we took our time to discuss hypertension, and this week we are looking at gastritis, or in other words, peptic ulcer disease. What people say it is ulcer or stomach ulcer. Because if you go across our hospitals, you come across a lot of people who are trooping in, day out, with the signs and symptoms of peptic ulcer or stomach ulcers. That is why today I have taken my time to take everybody through, or take all of us through, what stomach ulcer is, and then what the risk factors are, or the causes are, and how together we can overcome them. Yes, so what is stomach ulcer? That is the question we are looking at. So stomach ulcers, or gastritis, or peptic ulcer are basically inflammation that usually happens around the GIT or the intestine, all right? Or you finding a sore around anywhere within the intestine, either the the small intestine or the large intestine. Okay, that actually poses some health risk or some difficulties to the person who is going through this kind of situation, which is the ulcer. Yes, so basically it's having a sore around your GIT, any part of your GIT, whether the small intestines or the large intestines. That actually poses a health risk to you. For some people, when they suffer this condition, they begin to have some heart pain or chest pain. We call it epigastric pain around the right chest, okay, the right part of the chest, down towards the lower back. Okay, some of them it even radiates or pain to the back of the individual. All right, yes. So when you begin feeling some of these things, severe pain that actually radiates back to the back side of you, you should start suspecting that you are feeling, or you are coming towards, you are beginning to suffer stomach ulcers, right? Yes. So today, if you go across our hospitals, a lot of patients come in with these ulcers, all right? But how do we know whether you actually have a stomach ulcer, or is something different that is worrying you? You have to go through some labs for the physician who is actually taking care of you to confirm whether, yes, indeed, it is stomach ulcer or something different, okay? So we'll have to do what we call either endoscopy, right? We'll do endoscopy on you to find out whether you actually have this stomach ulcers. Endoscopy has to reveal to any clinician or any doctor or any physician that has made this request that, yes, indeed, you have the Helicobacter pylori, the bacteria that actually causes stomach ulcers in you, in a disproportionate amount, or in a higher amount, capable of actually causing blood or causing any inflammation within your GIT. All right. Yes. So the endoscopy will reveal that, and then the doctor will start the treatment for you, the patient or the person involved. Great. So, what are some of the basic causes of stomach ulcers? We can look at them in various categories. One of them, as I said, is the exposure to the Helicobacter pylori, the bacteria that actually causes corrosion or inflammation of the GIT, and then exposing us to pains, right? Yes, so that's one of the causes. The second cause will be the use of painkillers. Excessive use of painkillers, non-steroidal anti-inflammatory drugs such as aspirin, and then other medications that are painkillers, can actually also expose us to stomach acidity, high levels of stomach acidity, or inflammation of our GIT, okay, that will give us the pains, right? Good. So painkillers can actually also cause what's the name? Oversecretion of acids in our stomach, and then that can lead us to what we call the stomach ulcers or the peptic ulcer disease, right? If you're also somebody who habitually takes alcohol, okay, it can also lead you to having stomach ulcers, all right, or the peptic ulcer disease. So one of the cardinal causes of stomach ulcers is also the habitual intake of alcohol, all right, that's also one of them. And then stresses. Another cause of stomach ulcers could also be stress, undergoing so much stress that allows the stomach to secrete a lot of acid within the GIT, can also cause an inflammation in us, all right? So we need to be very cautious when something worries us. We should take our time and then reflect on it, and then do not allow it cause so much pain to us, okay? Yes. And then the other aspect of the cause is overconsumption of acidic foods, right? If you are somebody that actually takes a lot of acidic foods, it increases the production of acidity or acids within the GIT, and that can actually also affect your GIT, cause inflammation or corrosion within any part of the GIT. So acidic foods, too much acidic foods can also predispose us to stomach ulcers, and then we should be cautious of how much we eat of such foods, okay? The other cause is if you also have a family history of peptic ulcer disease. If either your mother or your father or any person relating by blood to you has ever suffered peptic ulcer disease, then you are also at risk, and then you should be cautious of some of the things you do, especially the use of excessive use of painkillers, which is number one, excessive or habitual intake of alcohol, which is number two, and then undergoing too much stress that can actually cause excretion of acid, too much acid in your GIT. Okay, yeah. So for people who also smoke, any type of smoke, whether it is weed, whether it is tobacco, or any form of smoking, or shisha, which has been rampant lately, can actually expose you to stomach ulcers. So my young ladies and young men who are within our various clubs and then enjoying yourselves, please be cautious of this shisha or shisha thing, because it actually predisposes us to peptic ulcer disease or stomach ulcers, okay? So let's be cautious about some of these things, all right? Yes, so basically, these are some of the causes of stomach ulcers, and then we should take caution and avoid them, and so that together we can have a healthy life, and then go about our routine or day-to-day activities, all right? Great. So, but if you happen to go through any of these things and you need care, you would think that you need a physician's care or a doctor's care or a clinical care to moderate the situation or overcome the situation, do not hesitate to call any of the numbers that is rolling down there for our services, okay? So I mentioned some of the signs of this stomach ulcers or peptic ulcer disease are having excess pain around the epigastric, okay, that radiates towards the lower back, right, the lower back of you. Any if you say oh hona ebia eduane a wota dia na say nuru a wota fa no oh hona wote say oyam ana say oboso ehyehew na oyam so eye okese edeko wachi a hwehu say ebia na stomach ulcer ene eya how ntie we say we are hweye, okay? Na wohu ni sanso a mepacho animonimu ya fa ohun kwa ya sabia na hwe na numbers na wase hono tumi fremu bia mefa call no na mabɔ wama oyare a ɛhawa yɛfrɛ no stomach ulcer no mesi ho kwan ama ɛnyɛ nyameden mahwɛ nkɔfo bebree a ɔmafa ɔmo ho afa ɔmo ho ama ɔmo ho atɔ ɔmo nti no stomach ulcer biara ɛhawa ɛnyɛ den sɛ mehwɛ na mebɔɔ nneɛma bi sɛ wɔsɛ gyae sɛ ebi a woyɛ obi a wɔnom nsa bebree a ɛtumi kɔfa ulcer ba okay woyɛ obi a wodi nnuane a acid wɔ mu a bebree a ɛtumi kɔfa ulcer ba na wɔn nso wɔanhwɛ ɔbra yie na ebi a wodi nnuane bi a bacteria bi wɔ mu bacteria na ɛtaa ɛwe yɛn nsonoma tokuro ba mu no a yɛfrɛ no helicobacter pylori no ɛno nso tumi kɔfa stomach ulcer ɛde ba nti momma yɛnyɛ ahwɛ yie na mmerɛ ne mmerɛ biara no yɛn siesie yɛn ho na nhwɛ aduane a yɛdi okay woba masɔyɛ a mede bɛfa nneɛma bebree mu a ɛnni na wɔtwe mpo na stomach ulcer na wo ne w'abusua abrɛ no a ɛngyae da no anaasɛ ɛto ntwa da no ɛbɛtwa ama wo ne w'abusua mmɔfa mo ho ade nti fa numbers na ɛwɔ ase hɔ no na frɛ me na me ne wo ndi nkɔmmɔ ɛmfa stomach ulcer na how wo ne w'abusua no na ɛso ntwa at this juncture I want to send warm greetings to all of you, my